A facelift is a cosmetic surgical procedure to improve the appearance of aging signs in the face and neck. It especially improves the heaviness at the cheeks, at the nasolabial folds. It improves jowling along the jawline, and it also improves the skin laxity in the under neck area. It's very suitable for patients who have early signs of aging where these are just becoming apparent and they wish to address them straight away. And it's also suitable for patients in older years because it really does entirely change the face and reverse the signs of aging that are present. A facelift is performed through surgical incisions at the front and just behind the ear. The skin is lifted up to expose the underlying muscle layer of the face, otherwise known as the superficial musculoaponeurotic system, or SMAS as some people may call it. This is then tightened and redraped to achieve the lifting and change of the face and changing the shape of the face to a more youthful appearance. And then the skin is redraped over the top. Any excess skin is removed and stitched back in front of the ear with a scar that is imperceptible once it is healed. It can be done under both general and local anaesthetic. The technique is very, very similar. Some people choose to have general as they do not wish to have any awareness of what's going on during the procedure. And sometimes I suggest general anaesthetic for those where they have a very heavy neck and I want to be very involved with the muscle in the neck, and that requires a general anaesthetic. But most facelifting can actually be done under local anaesthetic at the clinic, particularly for those who want to address the early signs of aging. This lends itself very well to this technique. The procedure takes approximately 4 hours in total. That's approximately 2 hours per side in order to entirely complete the facelift. The recovery process can be quite involved for facelifting. People do often experience swelling and bruising following this, and I ask my patients to refrain from any heavy lifting for approximately 6 weeks in order to mitigate any rise in blood pressure that may cause a swelling in the face. We give anti-bruising medication to limit the amount of bruising that is caused during the surgery, but essentially after about 2 weeks that is down to a minimum. After a week, patients can apply makeup over this, and any contour irregularities or issues with the scar and scar healing take between 6 weeks to 3 months to completely settle down. Because the skin has been tightened back, like tailoring any material, one cannot remove an excess of skin without some contour irregularity that does settle down after approximately 6 weeks. For example, if you look at this glove, one cannot tighten material without forming a ridge or a contour irregularity within the glove. And it is the same when one is pulling back the skin of the face, that there are some contour irregularities, often along the cheek here, that after 6 weeks completely disappear and settle down. People should expect at least 10 years out of any facelifting procedure, particularly if the underlying muscle area is addressed. The sutures that are used to redrape and tighten the muscle layer are permanent, and they are anchored to very strong ligaments at the top of the face and at the back of the ear, and so this achieves a long-lasting result.